Hi there, this is Debbie Nicholson. I'm the Director of Community Outreach for Beat Cancer. And I was approached by this wonderful woman who happened to find Beat Cancer by chance, and she has a really great service that she wanted to bring awareness to. Her name's Elizabeth Turnbull. So she likes to be called Beth. So welcome, Beth. Thank you so much for reaching out to us. It's so
Thank
nice
you.
to have you with us.
Thank you for having me. I'm really excited.
Sure. So Beth's going to tell us all about her background and her services, and we're going to find out more about what she's offering to breast cancer survivors, people that have had reconstruction, and many more opportunities. So why don't you tell us about your background a little bit, Beth?
Okay. Well, in 2014, I was diagnosed with stage 2 breast cancer. I was told that I had 2 tumors and 2 separate cancers. One, which was a triple negative, which is a more aggressive form of cancer. So it was pretty scary. I did do 8 treatments of chemo. I did have a bilateral mastectomy. And I also was originally told I didn't need any further radiation or proton. But after my mastectomy, they found some microscopic cells in my sentinel node. So therefore, I had to go and do the radiation. I opted to do proton therapy, which is a safer form of radiation. It doesn't hit as much as your heart and lungs. So I did 20 treatments of that, and that's when I had problems. Anything that could have gone wrong did. So I had multiple skin infections. I had lost an implant. I had 2 reconstructions after that. Up having to wear a prosthesis for 6 months. And in the midst of all of this happening, my original plastic surgeon was also diagnosed with cancer. So I was kind of left up in the air. Where am I going to go? What am I going to do? To make a long story short, I was able to get in with the chief of plastics down at Penn, and I had something called tram flap surgery, where they pretty much cut you hip to hip, go up and around the belly button, and they make a breast out of your stomach. It's a very intense surgery. They microscopically put your arteries back together. You're in the hospital for 4 days. It's not fun, and they don't really
Pretty
tell
intensive.
you. Yeah, they don't really tell you you're not going to be able to stand up out of bed immediately and sit upright in a chair. I mean, you have to stretch the stomach out and the skin out as much as you possibly can.
Wow.
It's a long recovery, but without having that doctor and that team, I wouldn't be sitting here feeling amazing.
Wow,
So
that's
with
great. It's great that you made it through and you're doing good.
I made it through. I did have a couple of surgeries afterwards for reconstruction. I did have fat transfers to make the breasts more similar and normal looking. And yeah, so I've been through the ringer. So I know a little thing or two about breast cancer and surgeries and recoveries.
And how many years ago was that?
My 5-year anniversary is this November. I was diagnosed this November 5 years ago.
Wow, that's wonderful. Congratulations.
Thank you. Thank you. So with that said, I tried to turn my negative into a positive. I did decide to get the 3D nipple and areola tattooing done. I was one of the models, so they call them. So I went to a plastic surgeon's office down in Philly, and I was able to have the tattooing done for free by a student, not by the owner of the organization. And while they were doing it, I was like, "What? I want to do this. How do I get into this?" I do have an art background. I went to college for art, and I needed to know everything there was to know about this tattooing, because when I left that place that day, I literally skipped to my car. It changed my life.
Oh,
So it's emotional.
that is very emotional. So you felt a little more complete, and that helps to move forward. So I see with an art background how you would want to get into that and help others.
Right. I felt like a woman again. where
Right.
you're so used to looking at yourself a certain way with all the scars that you have. You kind of get used to it. So after I had this done, I mean, I'm ready to show everybody. Look at me. I'm normal again.
Do you want
Whatever
to
the
tell us a little bit about the procedure, like what it's like?
So it's very it's not an invasive procedure. There's little to no downtime at all. So I got into it because this is what I wanted to do. I wanted to help other women feel whole again and make them feel like I did. So I did take the course down at Penn. It was a very intense course where they teach you everything you need to know about color mixing and shading, how to make the 3D nipple and areola, color match. So I took that course, and then I made it my mission to put the word out there that this is something that's real. I'm local, and it's something that I think a lot of people aren't educated about because they don't know that it exists.
Right.
And I also don't think a lot of people know that most insurance companies do cover this procedure.
Wow.
So what it is, if you set it up with me, we make an appointment. We have a free consultation. I explain everything. I can answer any question that you have, and from there on, we make the appointment. If you have a bilateral and you're getting 2 tattoos, then it takes about an hour and a half to 2 hours. Once we're finished, I cover it with Tegaderm, which is kind of like a plastic wrap that keeps moisture out so you can heal. You're able to shower the next day. And in 3 days later, you're able to take the Tegaderm off, clean yourself very gently, and you're off.
Wow. So that's not too long. Is it painful at all?
Not at all. With most mastectomy patients, you lose complete feeling. You might feel a little pressure here and there, but you don't feel as if you're getting a regular tattoo.
Okay.
There's real minimal pain.
Okay. And who would be a candidate, or maybe who would not? Is there?
Someone who's not a candidate is somebody who's not 100% healed and cleared from their plastic surgeon.
Okay.
Surgeon has to say, you're cleared, you can have this procedure done. If you're not cleared and you have an open wound, I will not do the tattoo.
Okay. Wow, that's really amazing. And how about the cost?
The cost, it depends. If, like I said, it's usually covered under your insurance, and it would just be your copay.
Oh, wow.
If
That's really amazing. And
it
you're
is,
kind of in the Philadelphia area?
I'm located in Bucks County,
Hmm.
but anybody that's willing to travel, or if they live in the area, I'm more than willing to at least have a consultation, answer any of your questions, and hopefully be able to book your next appointment.
Okay. And the healing time's only a couple of days then?
It's a couple of weeks
Couple
because
weeks.
like your skin starts to flake, so you need to keep that area moisturized.
Okay.
Kind of like a scab. You don't want to pick at it because the pigmentation will come off and your tattoo could get ruined. I also offer free touch-ups as well. So if you feel that you want a little bit darker, your areola darker, then we can set that appointment up as well.
Okay. Oh, wow, that's really amazing.
Mhm.
I never would have even thought of that, but I guess anybody going through reconstruction would be really curious about getting that, because how do they usually leave you?
You're left with nothing. You pretty much look like a Barbie doll with nothing there.
Wow.
With just a cut with scars. You're left with nothing but scars. So with some people, it takes a toll on them mentally. I know I had a hard time with it in the beginning, but you kind of get used to it. Not everybody wants to have the tattooing done, which is completely fine. I wasn't sure if I wanted to have it done either, but one day I went to my plastic surgeon. He said, "You're cleared. You don't have to come back." And I said, "Okay." He said, "Do you want to have the tattooing done?" And I thought about it, and I said, "You know what? I'll see what it's about." And that was my decision to have it done.
It seems like a really great thing to look natural again. It's not a long or painful or very expensive. It's covered, so it seems
Right.
like a great option.
It is. Like I said, it's not for everybody,
Mhm.
but I know how it made me feel. and it made me feel like a woman again, because they take your breasts away, and you're left with sometimes nothing. Some people don't want to have the reconstruction. Some people, like myself, have many complications where you lose an implant and have to wear a prosthesis. And I'm just so lucky and grateful that I had the family and friends that I did, because I had that moral support. And I think that's what's most important when somebody's going through something like this, that they have somebody there to, cheer them on and say, you know what, you're doing a great job.
Right.
We're here, and whatever you need, we'll be there for you.
It's so nice too that you're a survivor and you understand and you can provide the service.
Yes.
And then people are more comfortable.
That's what I think when I do tattoo patients. We do have that bond, and I think it makes the patient more comfortable, because that we have a common denominator. We both went through it,
Right.
and that's a common piece, which I think makes the patient a lot more comfortable getting tattooed. I mean, you're exposed. You're in a gown. You have your breast hanging out, and somebody's
Sure.
and tattooing it. So to have that in common, I think
Right.
it's really important as well.
And where can people find you?
Well, I do not have a website, but I am on Facebook. I'm Elizabeth C. Turnbull, LLC. I'm also on Instagram, Elizabeth C. Turnbull.
Okay, we'll post that with the blog article with this podcast so everybody in the area can be sure to find you. Is there any, wonderful, is there anything else you want to tell us or anything else we should know?
Well, like I said to you, I do have a surprise, and I'm taking your advice because of everything that I've gone through, and how I've helped other survivors get through their experience. I'm going to become a certified coach, because I feel like I got breast cancer for a reason, and if I'm able to help anybody else, then I did my job.
Absolutely. And survivors, I think, really make wonderful coaches. They understand the state of disease, what got them there, what got them out, and there's a path of awakening and awareness and healing, and I think it's a beautiful thing, and you're going to make a great coach. So that's wonderful. I'm so happy you reached out to Beat Cancer, and
excited.
And that you were brave, brave enough to come on here and share your experience and offer this wonderful service.
Well,
Thank you so much
for having me. I think everything happens for a reason, and there's a reason that I saw that sign that day, and once I Googled BeatCancer.org, this was something that I felt really passionate about, and I really wanted to be a part of.
Thank you very much for being here, and we will put your contact information with this podcast so everyone can reach out to you. And are you willing to answer questions if maybe someone's not in the area but they have some questions?
Oh, of course, 100%.
Great.
You can message Facebook. That goes right to I get notifications. It goes right to my phone. So if I can't immediately get back to the person, then I'll get back to them as soon as I possibly can.
Wonderful. Okay, great. Thank you so much for being with us.
Well, thank you so much, Deborah.
Great, thanks.
All right.